It's not my fault. So tell that platform you don't appreciate that. This is not easy money. We are going to work out of our doctor's office, even if he stuffed me in a closet. And then next year, I'd like the norm to be 15 to 20 visits a week. Some might even say yeah, and then they don't show up. Those are called no-shows. Guru Nation, thank you so much for watching and listening. Make sure you like, subscribe, comment, share. This is ad-free YouTube channel. And if you're listening, it's ad-free podcast too. And if there is ads, it's not my fault. So tell that platform you don't appreciate that. Listen, help me get to 100K. I want that YouTube plaque. That's all I ask. Today's video / podcast is titled How to Fail as a Site Owner. Because we talk so much about this is what you got to do. This is the steps. We've made 3-hour blueprints on exactly like following the roadmap for how to do it. And people still have questions, and we still run into like client calls. Myself and Chris, we help people start sites and we help small sites grow. People still are a little bit confused. Like this is going to be a lot of common sense. But I think a lot of people need it because this is not easy money. Having a site, I think a lot of us at SOS, so Save Our Sites, we've been running sites so long, like maybe it comes off as being easier than it is. It's not easy. And on top of it all, you have to be in a market where, like a geographic region, where it's going to help you as well. Because like I'm doing very good here in Yuma, Arizona, because there's no other site within probably 200 miles of where I'm at. But if you put me in San Diego or LA or Miami, I mean, things would not be all that great all the time either. I still think the cream rises to the top, and I do think there's a lot that has to do with experience and the PI and the staff and how you're going to get patients and how you demonstrate yourself and how you network and all those things. But the people we've been talking to, like, they think it's easy, and it's not. Like, there was this coordinator recently that we had a call with, and she was saying, she's been a coordinator for 10 years. Her PI is excellent, and they want to start a research site, and there's another doctor that she wants to use as her PI. The doctor has a private practice, but they want to start a research site outside of his private practice. And in an expensive market, like when I moved here to Yuma Clinical Trials in Yuma, Arizona, there was not even a consideration of leasing a space. It was, we are going to work out of our doctor's office, even if he stuffed me in a closet. We were going to get at least our first study or two, get a runway of revenue going, like get 2 or 3 patients randomized. If you are doing all the work, coordinator, all the regulatory work, and you randomize 2 or 3 patients on a modestly paying study, you have a cash cushion now to where you can now consider, let me lease a bigger space. And like the place we're sitting in here now, we have 1, 2, 3, 4, 5, soon to be 6 rooms. I would never have done this on day one. We didn't rent this place until almost year 2. We were on year 2, or right around like the 1 year and like 10 months, where we literally were told by the doctor's office, hey, like you guys are using a lot of space and we don't have more space to give you here. So we were literally asked to find space to expand, and we're still using our space in the doctor's office, but we've outgrown that. And since then we've gotten new specialists and specialties, and a lot of them have told us the same thing. Hey, and now we have the luxury of having our own. So the first rule as a site owner, if you want to fail as a site owner, the first thing to do is to lease your own place. And if you want to add some cherry on top, personally guarantee that lease in your name. I mean, number one, first way to fail as a site owner. Get a lease a place before you even have a study. Lease a place before you enroll a patient. Just don't do that. If you want to fail, go ahead and do that. Number two, you want to immediately start paying yourself. That's a way to fail as well. You cannot afford, especially if you want to expand into your own place, you cannot afford to start paying yourself a salary until you get consistent study visits. And our site, for the last year, we've been averaging about 10 visits a week, which is fine. I really have a stretch goal, and we have another month left to do it, which I think we will actually hit a week before this year's over, where we have 20 visits in a week. And then next year, I'd like the norm to be 15 to 20 visits a week. Once you get to like a consistent stream of visits, and you know what your monthly nut is as far as paying your rent, and you know what your monthly nut is as far as paying your salary, you know exactly how many patients a week you have to do. And there's a few weeks, if you go under that patients per week, you know that you better reverse that trend very soon, or else you're not going to be able to afford your rent, or you're not going to be able to make payroll. I mean, business is very simple. Like, we're not talking about NIH grants where we mess around with taxpayer money and do whatever we feel like. And we have complete disregard for efficiency. And this new administration's coming in, and they're fixing that, because it's not you can't run a business that way. How are you going to run a country that way? So us small business owners, we never had to worry about getting government grants. Like, we eat what we catch. So if you're going to talk about paying your rent right away, you better have a consistent way of paying that rent, consistent revenue coming in. Same thing with having a payroll. So number one, best way to fail as a site owner, I've already said, get a lease from day one before you have a study, before you have patients. Number two is to start paying yourself, because if you're not going to see real revenue and like consistent revenue for 9 months. And so you should plan on revenue for a minimum of 9 to 12 months. Like, if you're going to go out on your own and start a site, I think if you plan 12 months of like very low revenue, and because you're figuring it out, especially if you've never done a site before, you're going to need that 12 months of runway. So you're going to be living off of savings, and you should be living off of your physician's private practice. Like, you should be in their office. We never dreamed of having our own space until, like I said, we were kind of told, hey, you can't expand anymore. And then we had enough money in the bank to have a lease. And now we're expanding, and now we have other specialists coming on board. So, but if I would have gone from the beginning, before I got my first study, and signed a lease, and then personally guaranteed that lease in my name, I would have been screwed. Like, all the money coming in would have been just to pay the rent, and then how am I going to pay myself anything? I wouldn't have been. So there's a lot of people out there that haven't figured this out. Yes, of course, it's better to have your own office space than to share the office space with a private practice. But even when you have money, there's benefits of being integrated in your physician's private practice. You get more referrals, first of all, when you're there. So there's a trade-off too when you go expand into your own place and you don't go to the private practice as often. The providers don't see you as often. The providers are busy. They're going to look around the office for you for a minute or two, and then they'll be over it because they got another patient. So the grass is not always greener on the other side either. So I think those are the two big ones. I think starting from the existing private practice, minimize expenses, having a database of patients from the physician's private practice is the way to go. Another big thing I see if you want to fail as a site owner is don't have a physician with a private practice. Because, yeah, you can run ads. We have things like Patient Ace you could reach out to me about. We could help your site get patient referrals. But if you don't have a private practice to pull from or a guaranteed way of getting attempts of patients, like people to call, that's a physician's database. That's a private practice. You're going to need to call like 20 patients for one of them to show up. And you're going to need to call like 100 of them for like one or two to get randomized. Because in order to get randomized, someone has to agree first to do a study. That's not all 100 are going to agree. Matter of fact, half of them are not going to answer the phone ever. And the other half are going to say different things. Some might even say yeah, and then they don't show up. Those are called no-shows. So it's a very low accrual rate. And then we're talking about attrition afterwards, and then the protocols are just complex, and the inclusion-exclusion criteria is very strict. So it's a lot more, you need a lot more numbers than you think you do. So those are the three biggest ways to fail as a site owner. If you want to guarantee that you're going to fail as a site owner, those three things: lease a place, and even worse, lease a place, personally guarantee it, and then go crazy with decorations, like buy all this fancy equipment and things and exam tables that patients are never going to lay on, because you're not going to make it that far. You're going to run out of money before you get a good study where you can actually recruit patients. So number one is leasing a place before you start. Don't do it. Partner with a private practice physician. Number two is expecting that you're going to pay yourself right away. It's not going to happen. Plan on 9 to 12 months of no income for you. And number three is not having a consistent place, like a database of patients coming through that you can screen. So that's it. Then there's other things later on: how to find staff, how to train staff. I guess if I would add number 4, it's never hiring or not delegating. We're at the point today where I do very little as far as like in the business, but I work a lot on the business. But in the business, I'm almost completely removed. I do a few psychometric rating scales, but I have staff. We've delegated the work to the staff. So that's the fourth way to fail as a site owner: is you cannot scale because you're only one person. And if you don't have a system of how to delegate, how to train, how to attract and retain staff, you're not going to be able to do more than 3 or 4 studies a year. And if you want to start making millions, you're going to have to do like 8 to 10 studies a year at least. So those are the 4 ways to fail as a site owner. Hopefully some reverse psychology helps for you guys and gals. Like, subscribe, comment, share. I'm about to do a podcast with Dr. Joe Show right now. Bye-bye. Hey, if you guys like that kind of content, make sure you like, subscribe, comment, share. Stay tuned for more videos.